Want to resolve your keloid scar mark and it's not at all going even after so much of treatment, and you're feeling so much of irritated, or you're unable to uh, go through any kind of treatment because you're lost hope, and you're kind of needing some help from anyone to remove this scar permanently from your body, then this video is for you. Homeopathy can help you to remove the scar marks of the keloid. Today in this video I'll be talking about how to remove your scar marks with the help of homeopathic medicines, and which are the important homeopathic medicines which are really helpful in the removal of scar marks, because the scar mark which you are seeing outside is not completely external, it is also related to internal. When you remove the internal cause, only you can really treat the external one. Without that, if you're just applying some cream, or you're doing something which can really kind of help the tissues which are outside to move away, of course it's going to come back. So what you have to do is remove the internal cause so that the external cause will be also kind of treated. That's all. First we'll be knowing what is keloid and how it is formed and why it is formed, because of which deficiency it is formed, and what are the homeopathic medicines which are really helpful, and how you can treat it completely. Okay, we'll be talking about what is keloid. Scar formation in the skin following an injury. This is one of the important statement. What it is? Scar formation in the skin following an injury means you had hurted somewhere. The injury has happened. The skin is being damaged. After the skin is being damaged, the skin goes into inflammation, infection. After that the healing starts. After that the cells production start, and there will be an union, and there will be a recovering, means the healing of the skin happens. But when the healing of the skin does not happen at the right time, at the given time, then this keloid is formed, means scar formation is formed from an injury or an surgical incision. Means if you have went through any kind of surgery and the doctor has said no, it's not going to leave any kind of mark, but because the healing property of your body or the skin cells is very low, and the healing has not happened at the given time, or you are not taken an correct proper procedure, means the doctor will give you the creams, antibiotics, and you should do the first aid, and after that you should apply the cream. After that you should cover it, and you should not expose that to the water or the dust, any kind of thing, or you should not do any kind of thing which will make the skin a little bit tight and loosen up when the stitches are there. But if you neglect any kind of thing, or your skin is not uh, properly kind of developing, that time the keloid happens. The point of skin is raised with a scar on it, means there will be a mark. If you know the acne mark, for example, acne mark, or it will be a only mark on the skin. There is no extra growth on the skin, right? But keloid is not like that. There will be a point the skin which is upright of that scar, like that you will be knowing, and it will be also painful for almost 90% of people. Some people say it's not painful, it's only there, that's all. But no, for so many people it's so much painful. It takes so much of months to cure, and don't expect homeopathy or any other system of medicine to give you cure just in 1 month, 2 month, or just in weeks. No, you should have the patience, because you are suffering with keloid from 1 year. You want the recovery in 1 week? No, it's not going to happen. Of course time is needed for the healing, because it's not some kind of magic which happens. Okay, it is a thing which you should see with your eyes. Like if you are coming with acidity, okay, gastritis. If you are asking for homeopathic medicine, I give you the homeopathic medicine as it is an internal thing. I give you the homeopathic medicine. With the homeopathic medicine, so you will be better for 2 to 3 days. After that, you come back and I say take it for 1 week and just leave it. You're better now. And you on the first day only sees the progression, means your gastric symptom comes down. That is one of the sensational thing. But here the keloid, the external thing which you are seeing, of course it takes time because the changes will be happening, but you will be not knowing that. To know that changes you need some time, okay. Because of that it takes time, and to remove the cause from the root, of course the time is needed. Because if you are thinking of cutting a tree and the tree is so big from 1 year, if it is only from 4 months, 5 months and everything, you can just pick it out. But if it is already been 1 year, 2 year or 10 years, you need some extra things to cut down, right? First you will cut down the branches, after that the stem which is top. But cutting down the root and taking out the root is very difficult, right? So you should have that kind of patience whenever you're going to treatment, whatever system it may be. But you should have some kind of patience. But having patience and also observe yourself that your body is been reacting to that medicine, and that medicine is acting on that or what, because you should not waste your time also. Okay, moving on to the homeopathic medicines which are really helpful in the treatment of keloid. First one is acidum flor. Acidum flor is given in tablet form, that to 30 potency I prescribe, and I give it for 3 times a day. If the keloid is only small or only in one area, then I give it for 2 times a day. It acts especially on the scar tissues, and it is indicated in deep destructive and processed kind of ulcers. And you can also give, some people will be having this kind of thing, boils will be there, and after the boil is been, means all the pus has come out, everything has happened, but the reunion of skin has not happened, and the patient has also not taken care at the time. They thought that of course it's going to come back to normal, but it has not, and it has left an scar mark. After that it has developed as an keloid, and they does not know it is a keloid or what. They just think that it is just an skin infection and it will go away, and they just apply some cream which is available. No, you should not do that. Proper medication is needed, proper diagnosis is also needed, because it's very difficult for diagnosis of keloid, okay, because the clean observation is very much needed. And acidum flor acts really well on the scar tissues and repairing the scar tissues internally, because it has happened 1 year back and the scar has been internal, so it goes to there, it repairs that scar, and after that the new cells produces. After that the scar is going to decrease and the reunion of the scar happens. Okay, next one is graphitis. Graphitis is given in 200 potency, and you can also give it once a week, or you can go with 30 potency morning once a day. That's all. In an early stage of keloid, means the patient comes like 1 month ago they had went through some injury or something, and this keloid has developed, and they had already taking some medication, and they know that it's keloid only. Then they had come and it's fresh and everything. Early stages it's developing to be keloid, then you can give graphitis. And I already said graphitis 200 once a week, or 30 one time dose morning after the food you can also give. The keloid may ooze out a thin and sticky discharge in graphitis. Some people say that it's just dry, there is no discharge, nothing, and some people think that it's just an skin, and they take that safety pin and they just try to pull out that skin, and they think that cutting out that skin it reunions and it developed. No, it's not going to happen. Don't do that kind of silly things, because the scar mark is inside and the healing should be done. Without healing, of course, it's not going to happen. When there is a discharge in the keloid, then you can seriously, genuinely think of graphitis. Silicea. Silicea is also given in 30 potency, morning and night, or when you're giving graphitis also you can give silicea 6x biochemic. You can give like graphitis 200 once a week for 1 month, and 6x every day daily, like that, morning night, like that you can also give. Silicea's symptoms are like keloid growth may be on the spot vaccinated. When you take the vaccines, that also develops into keloid. And there is so much of suppression of the skin that time also you can think of. This was some homeopathic medicines which are really helpful in the treatment of keloid. Please do like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. Thank you so much. Have a good life and a wonderful life.